keeping people from going to the hospital. Since its arrival, health authorities have been working hard to build capacity and space for the arrival of COVID-19. Now, the good news is beds, well, they remain open, but with all that capacity now, there's fear that people may be avoiding hospitals or their doctors altogether. BC's top doctors even gone so far to tell people that it is safe to go to the hospital, especially if you have serious medical issues. Dr. Montana Halliday is one of our doctors up here in Northern BC on Carey-Secani territory. Thank you so much for joining me this morning, Dr. Halliday.
Thank you. Thanks for having me.
Now, these are unprecedented times. Nothing is normal, really. How have you been over the past few weeks and months, personally?
I think, and I didn't know I was going to be asked that. I've been initially the first few weeks, it was kind of nice working from home, to be honest. And now it's kind of all the uncertainty is a little bit overwhelming. How long are we going to be in this situation for? Missing social interactions and stuff like that. I didn't realize how important it is to have something to look forward to.
Totally.
And so that's me personally. I've really, for my work with Stalaco, I've found that I've really enjoyed the opportunity to get to call people when they're not sick and just see how they're doing and get to know the patients more. So that's been nice, but I do miss seeing them in person.
Yeah, this morning I got up and I was like, oh, I'm going to be on video, so I have to take a shower, do my hair up a little bit.
Right.
It's a weird period.
Me too.
Yeah, there's this like ongoing anxiety, like this invisible threat. Yeah, it's reason if I drive by the hospital and I see like an empty parking lot, not like it usually is. Like, what are you noticing in hospital with the crisis here?
Yeah, so I feel like I also work in the emergency department sometimes in Prince George, and my last shift, I only saw 4 patients in 4 hours. So everybody's done a really good job to stay home and help us in the hospital get ready for if COVID hits us really hard. So on one side, that's wonderful to have the time and the space available. But on the other side, I worry that people aren't going to the hospital when they need to actually go.
Well, I was going to ask you that. Like, they are, because I'm not entirely certain. I made it wasn't really a joke. I said to my kids when this all began, I said, "Hey, you guys, you can't get sick or get injured for the next like 6 months, okay?" But like, is there a fear? Do you think are people avoiding the hospital because they're afraid of getting COVID, or is it they're just following the rules? Like, what do you think is the reason or the rationale that's happening here?
I think it's both. I think people are definitely questioning if it's worth going to the hospital. And there's more virtual availability now, which helps sort of triage hospital visits. So all the COVID cases now, we encourage to call the COVID line. And I work there as well, and it can help triage who needs to go to hospital, who doesn't. And doctors are more available now because they have lots of virtual health. So but on the other hand, I think also people are staying home too long and showing up more sick than they might have in previous times. So I really do want to encourage patients, if they are experiencing a true emergency, like they put out some guidelines: severe chest pain, weakness in one side of the body, sudden overwhelming headache, or difficulty breathing or confusion. Those are all reasons to come to the hospital. And the hospital is safe because everybody's doing such a good job socially distancing. We are able to see patients with good protective equipment. There's not big crowds, so there's lots of space. The cleaning staff, I think, are totally the behind the scene heroes. They're cleaning overtime to make sure the hospital is safe for everybody.
Okay. So like, take me through this. So say for example, I'm getting, I have an ongoing, but I'm not entirely certain. So I'm on the fence. I'm nervous, but I feel like it's something serious. What should I do? I call the nurse line 811 and they're recommending I go to the hospital. So just maybe walk me through that if you don't mind.
Yeah, so I think if you're having symptoms of COVID that you're worried about, like sore throat, cough, fever, anything like that, then I would call the COVID phone number first. And I'll give it to you here. It's 1-844-645-7811, because you'll speak to a doctor really quickly. And if you are needing to go to the hospital emergently, we'll arrange for it to be done safely so that you're not exposing people along the way. We'll call an ambulance, we'll get you there, we'll have your own bay waiting for you compared to you just showing up. If it's not symptoms of COVID, if you're having sudden chest pain or you can't move half of your body, then just call 911. Because we're triaging COVID separately, it's safe for you to walk into the emergency department when it is a true emergency.
Okay. And our COVID-19 helpline again is 1-844-645-7811. That's 1-844-645-7811. And of course, people are going to be watching this not just in Prince George, but in kind of in remote communities as well. What do you say to them as well? Because I mean, that is also to get access might be difficult. They might not get the message. What do you say to people maybe in rural, remote areas as well?
Yeah, that's a good question. Also, it's so nice all the comments people are.
I know. I was going to share some with you as a surprise.
Oh,
I'll share.
nice.
Yeah, that is.
Oh, thanks,
keep
guys.
those.
Yeah, it's like I feel like one of those Instagram stars that get nice comments. It's great. But yeah, so for remote people, I still think the decision tree is COVID symptoms versus not, because I've had patients who are remote, I talk to on the COVID line, and I take that into consideration. So I take into consideration that an ambulance is not going to be able to get there in time. And I work with the families to get the patient to care as quickly as possible. If it's not COVID symptoms, like in some other emergency, then I would proceed to call 911. And not hesitate to come in to the nearest hospital. If it's not an emergency, but people still are sick when there's not emergencies, if you don't have a family doctor and you're an Indigenous patient, there is a new line that has been opened up for those patients specifically, and it's Monday to 7 days a week, 8:30 to 4:30. If you're an Indigenous patient anywhere in BC and you can't get a hold of a doctor, you can phone this number and a doctor will help you. So the number is, where is it? Oh no, did I lose it? Oh, here it is. 1-855-344-3800.
Thank you. I was also thinking about if I had to go to the ER. Normally, I don't think that far. ER is for like emergencies, right? So, like, I always think of I'm not prepared for them. But like, is there anything people should be like maybe have on side just to prepare if they have to go? And I'm also thinking about like etiquette as well. Face masks. Like, what should I be wearing? What should I be taking with myself if I'm going to go into the ER or to the hospital?
That's a good question. I think so. When you come into the ER, if you're triaged right away, if you have any symptoms concerning for COVID, they will provide you a mask, and it will be a clean one. I know people are trying to use their own masks, and the evidence is sort of mixed on whether those are helpful or not. The reusable cloth ones, those are helpful for to prevent you from getting other people sick. More than not having anything at all, but you can also contaminate yourself with it. So I think that I would go to the hospital and they would triage you and they'll give you the appropriate protective equipment. Other stuff to bring, the etiquette, I guess, would still be to try and keep the 2 meters. If you're coughing, to cough, not on the nurse or the doctor, that would be nice. What else can I think of? Other things to bring. I would definitely bring a cell phone because family members aren't being allowed to come in with the patient. They can still wait in the parking in their vehicles, sometimes in the waiting room, and doctors will call and update them. So you want to make sure that you have a cell phone that your doctor can communicate with your family members. And what else would be? I think it's kind of scary for people in that regard going to the emerge. I know I get scared going to see my doctor, and I am a doctor. I just get nervous. He's a lovely man, but I feel nervous anyways. And so it's hard for people going in without their supports of their loved ones. And so I think anything that would help make you feel comfortable in that time, if you have, like a token or something that makes you feel strong, I think that might be something worth bringing.
Okay. Now we have some questions that have come in. One from Grace Duncan, more of a concern. She says, I worry about our First Nations in urban and res and the reservation in regards to COVID testing. Some of our people may have virus and not know it. What do you say to that comment?
Yeah, so the testing has definitely evolved over this COVID time. When I first started at the COVID clinic, we were only allowed to test healthcare workers or people in the hospital because you had to wait 10 days to get the results of the swabs. And we were so backed up, and the North especially was way behind getting test results back. So we really had to allocate our resources. Now that's changed where anybody with onset symptoms 2 weeks ago, Indigenous communities were prioritized that they would get tested if they had any symptoms. Now it's all people everywhere. If they have symptoms, will be tested. We haven't yet gone to testing asymptomatic people. I think that might happen one day, but for now, we're just really trying to identify the symptomatic people because usually most cases are spread while symptomatic. I think last I read 17% are spread asymptomatically, but the vast majority are symptomatic. So we're just trying to target that. And what I do is I'm asymptomatic. I don't have symptoms of COVID, but I assume I have COVID because that helps me make decisions about social situations. You know, should I go and hang out with that elderly person? Am I going to feel bad if they end up getting sick? Should I be going out to Stilacco? Am I going to feel bad if they end up getting sick? Could I be an asymptomatic carrier? So I think that that's really important. If everyone's still socially distancing, even if you're asymptomatic, you're not going to be spreading it to other people.
Okay, good. And on that vein of talking about testing, Dave Smith has asked us: Is the antigen test available in the North yet, and is it being used? Does it exist? I don't know.
Does he mean antibody test?
I think that's what he must. I think he's referring to. I'm wondering if it's the testing he's talking about. It's the one where you can actually see if you actually have ever had it.
Right. Yes.
That's
So
my
that
assumption.
one is not available yet in North. I've heard, and um, this is not written anywhere, just like from talking to different people, that they're starting to roll it out in certain places in BC as a test, but we haven't received any guidance on it yet. The good thing that the North has received is a rapid, what's the name for it? Is a rapid response test where we know like within the day. And that is great that we have that in Prince George now, because people who are really sick in hospital that we need to know now, do they have COVID or not? Because it changes our
Oh, I
treatment
think I lost you.
options. Can you hear me? Hello? Can you hear me now?
I can hear you. Yeah, we're back.
Okay. We did in the North get that rapid testing that's done within 24 hours, which is great that we have it, because we want to know with really sick people, do you have COVID, do you not? Because it changes the treatment. And so we did just get that in Prince George. And so that's really exciting for us.
Okay, really good. We have another question. This is a good one because I mean, people are beginning to get in the process of wearing masks, and they're asking, when given a mask, will folks be given tips and tricks for donning and doffing?
Oh, that would be a good thing if they did. I
Mm-hmm.
feel like I need to be reminded all the time, and I received the training. Will they be given tips? I don't know the answer to that question if they have. If not, I think it's really wise for everyone to educate themselves, to YouTube how to don and doff appropriately. I've seen a lot of people wearing masks like this or like this, taking them off and then rubbing themselves with it accidentally. So there is a special way to do it, and YouTube's full of. Maybe we can post a video on
Yeah.
that. That would be.
What we'll do is in the comment section, maybe we'll post that below for people so they can watch that and see how to do it. Because I think there's definitely things that you can, once you put it on, if you touch your face, you could probably contaminate, right? So it's probably good to know. Philistine Olson writes, at the beginning of this in March, she came down with the flu, just body ache, and was told to call the COVID number. A month later, feels I think I'm so paranoid, anxiety hitting. Is it wise to ask for antidepressants? Might be beyond your scope, but I imagine she should maybe talk to somebody.
Absolutely. So I think that's a huge, like when I think of the impacts of COVID, there's from the disease itself, the people suffering from the infection, but I think actually people without COVID are suffering a lot as well. I think of people who are single or not in good in supportive relationships who are sitting at home all day every day. I know personally me, I start feeling run down by the end of the day and need to get out and walk because we're social beings. We need that connection, and all the unknown, it causes a lot of anxiety, and mental health is just skyrocketing in this time. So I really encourage everyone to reach out to their doctors. Doctors have a lot more time now because of all these virtual appointments. And so to reach out and talk about, managing their anxiety and depression. I've also heard that, which I hope this lasts after this pandemic. I've heard that soon there's going to be free psychology services available.
Hmm.
I don't have contact information for that yet, but I think that would be great because I think it's a crime that people have to wait 3 months to see a counselor.
Yeah. Yeah. Now, earlier you gave us the First Nations virtual doctor phone number. I'll say it again. It's 1-855-344-3800. Paula Wiley asked, if you call the new number for First Nations patients, will your family doctor get a follow-up report so they know you access that resource?
Yeah, that's a really good question. And yes, they will. If you identify your family doctor, they will get copied on the report. Same with the COVID line. We make sure that we transmit all of the information to
Okay.
the family.
I'm wondering, there's another message here, but we'll better check it. Oh, so thank you. You're welcome. I'm wondering, are there things that we may learn from all of this? Because if we're seeing efficiencies now in the emergency room, people going when they're sick, and also now the way that doctors conduct, like for example, I can call in my prescription. Do you think there's some great learnings here that we can take forward after this is all said and done?
Absolutely. Yeah, I think there'll be some things that we definitely take forward that help make everything a lot more efficient. I notice that patients are a lot more understanding when I'm late for my virtual appointments because they're sitting at home and going on with their lives compared to when they're sitting in my waiting room for an hour waiting for me. I definitely think that, not everything needs to be done in person. There are things that do need to be, but doesn't need, and it definitely helps triage things and take the pressure off the system.
Mm. Is there
Yeah.
anything else you'd like to add before we wrap things up? Any other phone numbers to share? Any tools, tips, or tricks for people to think about during this crisis?
Um, well, I think my main point that I wanted to get across was that we're still here for you as your doctor. I know I'm not coming out to Stelacco anymore because I don't want to bring a virus there, but I am still here. I am still your doctor. I still want to see you. I want to help you. If you're anxious, if you just want to talk to somebody, please book an appointment with me. And I know all doctors feel that the same way. If you are worried that you're having an emergency, please reach out. The hospitals are safe because we're doing such a good job. It's wise to talk to somebody before going to the hospital to see if it's something that can wait till tomorrow to see your doctor during office hours, or if it needs to go tonight, so you can use the COVID line for any COVID sort of questions. And honestly, on the COVID line, I do get people that call me just about non-COVID related symptoms like chest pain and stuff. And I still feel like that's a helpful resource to use. Doctors are there till midnight. You can call the 811 number. And then during hours, there's lots of resources available, including that new Indigenous Doctor of the Day program.
Hmm.
So those were my points. Reach out, stay connected with your doctor. We care. We want to be there for you. And I guess socially, my advice would be to try and keep yourself well, would be, try and get outside. You can still go outside. The virus isn't transmitted in the air as long as you're, the 2 meters away. Enjoy the sunshine, put in, get some exercise, and stay socially connected to people. Make Zoom meetings with your family, play virtual games together. That's all really important because we don't know how long this is going to be, and we got to stay strong and stay together apart is what they say.
That's great advice. And there have been a few more questions coming in the comment section. Hopefully, maybe afterward, you could provide answers for them afterward. I will give the COVID-19 helpline again. It's 1-844-645-7811. And that First Nations virtual doctor phone number, 1-855-344 3800. And stay tuned later this week. We'll hear from more of our doctors on other health related topics surrounding COVID-19. And a reminder, tomorrow we'll have a live session with our yoga instructor again at 9:30 a.m. And if you have any questions, comments, concerns, you can email communications directly, communications@csfs.org. And I thank you so much, Dr. Halliday, for joining me this morning.
Thanks so much for hosting this. I really appreciate
Yeah.
it. Can I just add one more thing?
Absolutely.
If I would way rather someone go to the emergency room if they're not able to run anything by one of these numbers, if something is not, if they're not able to contact someone to discuss their symptoms and they're worried it's an emergency, I would way rather them just go to the emergency department or call 911 than them sit at home and become sicker and sicker. So try the other steps first. If you can't do it, just go in.
Better safe than sorry. Thank you so much. And
Okay.
to all our to the nations we serve, the people in the community, we'll see you.